Good morning, Pittsburgh. Welcome to Current Conversations with the Pittsburgh Current. I'm Bethany Rue, Associate Publisher. I hope you guys are enjoying this fantastic, fabulous fall weather. This is my favorite time of the year right here, not when it starts to slide into gross, ugly winter time, but this particular sunny day is my favorite. We are here. I think this is a very timely conversation. We are being joined today by Dr. Ashley Kittridge, dermatologist with a practice in Upper St. Clair. Dr. Kittridge, welcome.
Hi, thanks for having me.
Thanks for coming down.
Absolutely.
Are you also enjoying this beautiful weather?
Oh, yeah, my favorite time of year,
Yes,
for sure.
me too.
Hands down. Yep.
Yeah, she had a scarf on too. We were both doing the whole scarf thing.
Yes.
Yeah, my boyfriend calls us scarf season.
Oh, yeah,
He's like,
totally.
yeah, one for every day. So we're going to talk about a couple things today. And then at the end, actually really interesting, we're going to be doing a live injection demo. So if you've ever had any curiosity about what it actually looks like to have some injections done, you're going to find out.
Yes.
While we're talking, I'm going to be monitoring Facebook. So if you have any questions for Dr. Kittridge while we're chatting, feel free to ask them and I will ask her on your behalf. And let's dive right into it. So as I mentioned, it's fall. It's getting chilly.
Yeah.
Furnaces are kicking on, and everybody's skin immediately turns into corn husks.
Yeah. So I've already seen it. People coming in with dry eyes or dry eyelid skin or just dry skin generally. And one of the things that they don't realize is that as soon as the humidity goes down, our skin changes and it feels that lack of humidity. So I often recommend changing a skincare regimen to a more appropriate fall into winter type of regimen. And that often includes a heavier moisturizer, making sure that they continue a retinol, but maybe they back down on how strong their retinol is. And then still making sure they protect their skin with sunscreen or sunblock through the fall and winter seasons. So those are some basic things that I change up for them.
So do people actually come in? I mean, you could literally tell the difference with the seasons, with the skin. So it's an actual physical change that is happening to your skin.
Oh, yeah. You see more dryness in the skin, or people say, I just feel dull, or it's really hard to keep my skin hydrated. I don't know what's going on. And, you know, what we use through the summer months, you know, isn't necessarily what we should be using into the next season. I tell patients all the time, just like you change your wardrobe, you should change your skincare regimen. And, you know, maybe they're using a lotion for hydration and I need to switch them over to a cream. Eyelid skin is really delicate and sensitive. So I tell patients, you know, that's often the first time where you might notice dry skin on the face is around the eyelids. So we'll often switch to a lighter eye cream to a more heavy eye cream. If your eye cream contains a retinol, I say take the retinol out, at least for the winter and fall season, when the air is just more dry and your skin might not be able to tolerate that.
Now, for people that might not know, what is retinol and what benefit does it have to the skin? And because you mentioned it as a moisturizer or it's just part of a daily regime, is this something everybody should be using? Or
yeah, so there's three things I talk about in a regimen. It's treating, so that's usually retinol. Retinols treat by multiple different aspects, but the main reason it's used and sold over the counter is anti-aging. So it helps with fine lines, wrinkles, helps even out skin tone. And so it's often in a lot of night creams that are over the counter. There's multiple different forms of retinols, and pretty much all over-the-counter retinols come with a little bit of a different strength. I do feel like some are a little stronger, a little better than others when you get them over the counter. The prescription brand is Retin-A. That's one of the brands. There's multiple brands, but many people know it as Retin-A. And it, again, is meant to target anti-aging. And, you know, in some patients, it's good for acne as well. But, you know, generally speaking, most, you know, are using it for anti-aging as an adult.
Okay, see, because I always thought it was an acne thing too, but really
it is,
yes. But it's also so much more.
Yes, it's a very well-rounded cream. It can be used for a lot of different things. So that's the gist of what a retinol is. So the three things I talk about is treat, and so that's with the retinol or your prescription Retin-A. So many people who are on a prescription Retin-A might not be able to tolerate a prescription because it is stronger through the fall and winter months, side effects being just a little dryness and irritation. So I'll say, why don't we switch you to an over-the-counter retinol? My favorite is made by Elastin skincare brand. That's a really good one. Alpha Ret is another one that you can get by Skin Better. They're gentle yet very effective, and there's science behind both those products. So I usually will, you know, switch somebody to a non-prescription if they're struggling with dryness.
Okay, excellent. See, good to know. Now I'm gonna makes note to update skincare regime for me. Yes. Now another thing too that I think people might not think about as summer fades is it's still important to wear your Sunscreen, yes. What do you advise your
Absolutely.
patients on, or how, explain why it's still important to wear it no matter what the season?
Yeah, so rain or shine, pretty much, there's always sunlight out there. Even on cloudy days, I've heard many patients say, even this, past weekend, I ran into a friend who was in Florida, and she said, well, it was cloudy, so I didn't need much sunscreen. I got burnt. Even on cloudy days, you get sunburnt. There's enough UV that still penetrates through the cloud coverage. And that goes for this fall and the winter as well. Anytime, you're planning on being outdoors, you should have a sunscreen on. Protecting your skin in your young years actually is the best thing that you can do when you're older. The sun exposure we have as kids, as teenagers, and in our young adult years starts showing up delayed 10, 15, 20 years later. And at that point, we're an adult and we're smarter about sun protection, but we've had this sun damage that's accumulated over the years and has put us at risk for skin cancer and photo damage. And then we try to reverse it. And it's not too late. It's never too late to reverse sun damage, but it is a lot easier to prevent it in the first place. So protecting your skin with a sunblock, sun protective clothing, big eye sunglasses, those are all the, trend. Hats, cute hats are available for sun protection as well. And then, using antioxidants is really important for sun protection as well. It doesn't replace sunblock. So if you're going to use an antioxidant in the form of a vitamin C serum, or there's a bunch of different antioxidants, vitamin C being the most common, you still need to combine that with sun protection. The daily wear sun protection, sunblocks for men and women, my recommendations differ a little bit. For men, I like to recommend the brand Ulta MD. It's really light. It is a sheer zinc dioxide, titanium dioxide based product, which is very safe, has long-term safety data. And so I really like that for my male patients. Some of my female patients even like that product. I tend to notice a lot of female patients wanting to pick more of a tinted mineral block.
Yes.
It gives them that little bit of coverage that they might want. And so for that, I really love Elastin Skincare's Tinted Hydra Tint, and Revision Skincare IntelliShade is really nice for that. And, adding a little bit of tint to it actually adds an extra level of protection because it has iron oxide in it. So you get a little bit more sun protection with a tinted mineral sunblock as well.
So there's science going on in your tinted moisturizer that you didn't even know about.
Yes.
So what level of SPF is good? Like, so I have a BB cream that I use that has sunscreen in it. Is that enough? I mean, typically, obviously product to product it will vary.
Yes.
But what should you be looking for, men or woman, when you're looking to really protect your skin, but also get that little bit of coverage?
So great question. It was a little loaded in the way you phrased it. So I actually don't ever recommend makeup relying on that as a form of sun protection, because we put it on the face strategically. We might not put it down the neck and chest and protect ourselves there. So I usually recommend using an actual sunblock separate from your other skincare products, separate from moisturizer, separate from your makeup, and using a product that is gentle enough on your skin that you could literally apply it to your eyelids, because we shouldn't forget about our eyelids. So that's why I really like the zinc oxide and titanium dioxide based skincare products for SPF. As far as the minimum SPF, 30 is the lowest.
Okay.
But I always say the higher, the better. The more, the better. And that's because we don't put on enough sunscreen generally. We don't put enough of volume on, and we don't reapply it as recommended. So to kind of accommodate for that, I usually tell my patients go up in the sun protective factor.
Sorry, I went to go check the comments,
No, you're good.
and you just popped up. It's like I'm watching you while I'm watching you.
That's funny.
I was
You
just
can't
checking
get
to see
enough.
if there were any questions. I can't get enough of you, Dr. Kittridge. I love you. I'm sorry. Carry on. We were talking
You're
about SPFs,
good.
and I just went and skipped the whole damn thing.
So you asked me about what's right to use, and then one thing I will bring up is there has been some controversy, in the news lately about the safety of sunscreens. And what I will say first and foremost is sunscreen is safe and you should be using it. It's been shown to protect your skin from skin cancer and sun damage. The controversy is around chemical-based sunscreen. So, not around the zinc oxide and mineral-based sunscreens. So if you are worried about this controversy, and basically what they showed is chemical sunscreens can get into the bloodstream. And we don't know what that means. We have no idea what that means. And we need to see it clinically out, and there needs to be more studies done to before we jump to any conclusions. But if you're worried about those studies, what I would say is switch to, again, a mineral-based sunblock, one that has zinc oxide and titanium dioxide, which has been on the market and used in multiple different forms for years and years. A lot of people use it as, zinc oxide as a barrier protection for diaper dermatitis, and we feel safe enough putting it on our baby's bums.
Yeah.
We should feel safe enough using that product on our skin.
That's good bellwether for whether or not you feel good about something. So, I mean, and I think maybe people, dermatology specifically, I feel like sometimes with people too, it's just one of those things that it might be something that you only think about when you have something, but I really feel like this is something people could come to you to help you like plan for them, right?
Absolutely.
Or is this proper for them? I mean, if somebody just has no idea what they should be doing, they should call you and come and you could sit them down and talk about it.
Absolutely. We do skincare consults all the time. And sometimes it's as easy as like a patient coming in and say, I'm noticing changes in my skin and I don't know what to do. Everything I use, I'm still not getting enough hydration. Where I really see dry patients come in is this time of year, but also certain patient populations. So as we become more of an adult and we get older and enter, our older adult years, there are changes that happen to men and women, with different backgrounds. So female hormonal changes can really play a toll on the skin. And so sometimes just adjusting their skincare can make a huge drastic difference in the way they feel, boosting confidence, and just, making them more healthy from the outside in.
So you talked briefly about the importance of getting into skincare younger, right?
Yeah.
So we were talking about that in terms of sunscreen, but there's other options as well that you might want to do when you're younger to help as you get older. Do you want to talk about that for a moment?
So there's a buzz term used for this. It's called prejuvenation. We are seeing younger and younger patients coming in requesting cosmetic procedures. The first thing I would say is when those patients come in, I think it's really important to hone in on what they actually like about themselves and really point out the positives, and really pick the appropriate patient to start doing some of the more invasive non-surgical procedures on at that age. The reason being is because once you do a procedure on a patient, they might find the next thing, or they might be looking for the next thing to do. And you can kind of get into this cycle of where they never really find their confidence. So you want to build their confidence and, emphasize their positives from the very first encounter. And so for a lot of these young patients who come in looking for prejuvenation, I will recommend first a skincare product or a skincare line or a skincare regimen and have them build upon that. If, they're coming in appropriately, they're starting to notice some genetic volume loss, or they have some things that, that can be corrected with minimally invasive procedures, then maybe those are appropriate patients to do a little bit more to. But I think it's really important in this prejuvenation phase that we're going through and especially millennial population coming in looking for these procedures to prevent any type of wrinkling and anti-aging, that we pick the right patient to do it in and we address it the right way, because it can be a downward spiral for some people.
Yeah, I could see that.
Yeah, absolutely. So some people, again, skincare regimen prevent by protecting the skin, hydration and moisturizing the skin, and then treating the skin, which is usually in a form of a retinoid and vitamin C serums, antioxidants.
Now, do you find that women are probably more inclined to come in, but you do see a lot of male clients, and this is a growing trend with some of your male patients,
especially with Botox. And when men come in, they like the term Brotox. It kind of masculinizes the procedure a little bit. But yes, I think it's more talked about between women that they do some of these non-invasive, non-surgical procedures, but also men are doing it. It's just less spoken about. And it has really increased over the years how many male patients I see. And just, it could be a little toxin or a little filler, and the appropriate patient and treated appropriate with the right products will really leave that patient natural and rejuvenated and not look like they were done.
Yeah.
And I think some of the males have that feel, females too, but I think some of the males in particular have that fear that they don't want people to know that they are doing anything, and there is a natural approach to doing it so that you don't look done.
Yeah. Well, and I think too, there is that misconception out there that you get that frozen, people are maybe afraid, but I mean, that's really not necessarily, I've never found it to be accurate. I think that that's not really a true thing that happened to most people. So I don't think that should deter people from looking into this.
Agreed. Absolutely.
What are some of the more common procedures that you see or that people tend to come to you? Like, what's kind of hot right now, I guess, is the question that I was getting at.
Oh, there's a lot of things. And, it changes by season, too. So number one procedure we do in our office as far as aesthetics is neurotoxin, Botox, Jeuveau, Dysport, whatever you want to call it. They're all very similar products. And I think across the board, that's probably one of the largest procedures done, in the nation. And outside of that, we do a lot of filler. We do a lot of microneedling. PRP is a big thing right now, so platelet-rich plasma. And basically what we do is we draw the patient's blood, we spin it down, and we use their condensed platelet-rich part of their blood components, which has all their growth factors and can help really stimulate collagen production and turn on our collagen makers in our skin. And we can use that in multiple ways. We use it for hair loss. So we inject it into the scalp to help with male and female pattern hair loss. We can use it for facial rejuvenation and inject it much like a filler would be injected into the skin in similar areas. And then we can microneedle it into the skin. So we do microneedling, which is this little pen, and it has these needles on. We numb you up real nice, and you just kind of lay there and listen to some music. We dim the lights sometimes. And we microneedle the platelet-rich plasma into the skin. Studies have shown superiority to platelet-rich plasma used with microneedling over microneedling used alone, and less downtime and better rejuvenation. So that has been a really big thing. And I think it's been big amongst many populations. It's been big amongst acne patients who have acne scarring. It works wonderfully for acne scarring, and it's used for rejuvenation. Males and females are coming in to get it done, and it's natural. And I think people really like the fact that it's coming from them. Yeah. It's not a foreign substance being injected into the body, and they feel more comfortable with that. It's definitely a gateway to other procedures for a lot of them, but also some people just maintain with that as well.
That's wow. See, and I didn't even know that was a thing. Yeah. So, so if you are sort of not really sure that you want to get like a injection from the regular kind of thing, you could literally get your own plasma injected, and that's amazing.
Yes. Another big thing that's, I'd say in the last year or two is cryofacials. So liquid nitrogen and, putting liquid nitrogen on some gauze and gently, rubbing it across the skin, or it can be sprayed across the skin too. You have to be careful with the eyes, but it is anti-inflammatory. It helps with acne, especially, comedonal acne, and it can kind of just give you a refreshed feeling. It's very simple to do. It's not painful. So that's also a big thing that's in the buzz right now.
Yeah, actually, I had a friend that just had it done. So.
Yeah, see?
So if you thought that it was just about Botox, you were wrong. Yeah. There's so many other things out there. So talk about collagen for a second, too, because I think that's, because, I'm getting to the age, and we won't say what age that is, where, like, I'm starting to, like, feel like I might be ready for fillers, which is, but that's because as you age, what happens to your collagen?
So by the age of 30, one of the first aging changes we have is bone resorption. And the nice fat pads that sit on top of our bone that give us our volume in our face and our contour and our features, as the bone resorbs, our fat kind of sits lower, and we kind of get a sunken appearance or less volumized appearance, so to speak. And so after the age of 30, that really accelerates. Women really notice changes after the age of 30. I see it a little bit more delayed in males. And that's just across the board. It's nothing necessarily that you're doing wrong. Of course, you can do things to slow it. Protecting your skin. Sun is one of the biggest things that can accelerate aging and the breakdown of collagen. And the same with smoking and drinking alcohol, not taking care of your skin, not eating well, not drinking enough water. Those are all features that can accelerate aging. But, after the age of 30 is when I start hearing, I hit 30 and And so, and then another big, you know, age group where I see women come in more so than men is when they're premenopause. And that's, you know, between 41 and 47 for a lot of patients. And they'll start saying, well, I'm starting to notice even more volume loss, or I feel sunken, or I just feel dull, or I can't hydrate my skin enough. And that's oftentimes the hormonal changes that are happening in the premenopause time period. And so a lot of times addressing those early on is really helpful for, you know, obtaining the goals that they have.
Prevention is key,
Yes.
and all things here.
Yes.
Well, we are going to do, as I mentioned before, we're going to do a live injectable demo with Alicia, who's been sitting over there patiently. So we are going to get to that right now. And I think I'm going to actually give over the camera and everything, and we're going to let you go. But I do want to say you could actually find you online. And we'll put the website and everything on there, but it's kittridgedermatology.com. I'm going to spell it Kittridge, dermatology.com. You can book online. If you have any questions, come in and see her, talk to her, get a custom skincare regime. Yeah. And I hope you guys are ready for this. We're going to break to a quick commercial, and we come back. Dr. Kittridge is going to be doing a live injectable demo. All right. We'll see you guys in just a few shakes.
According to the latest readership data compiled by the Media Audit, a Houston-based independent audience measurement firm, the Pittsburgh Current's twice-monthly print publication has a readership of 174,000 people. That makes us the third most read publication in this great city. Thanks to our readers and our listeners for continuing their local support of free, independent journalism.
This is your moment. Drink it in.
Hi, y'all. Welcome back. This is Alicia. She's our model today. We're going to be doing just a little bit of Botox. We're actually going to be using Dysport. Everybody knows it as Botox, but there's multiple different neurotoxins to relax muscles that that create lines on our face. And today, mostly what we're going to be doing, because she's young and beautiful already, is just evening out some asymmetries and giving her a little bit of a brow lift. So we're mostly going to center around that today. Neurotoxins, Botox, Jeuveau, Dysport, Xeomin, they can all be used in multiple areas on and off the face. They can be used in the forehead to help forehead lines, in the glabella area, which is between the brows, to relax those muscles and lift up on the eyes, so you provide a more wide-eyed appearance. And it can be used to even out brow asymmetries as well. Around the eyes, it can be used to treat crow's feet. We can use it in the muscles that pull down on the corners of the mouth to release some of the frowny face that we tend to, some people tend to carry, especially if you're strong in the lower face. Toxin can also be used along the jawline to relax that muscle that attaches from the cheek down to the chest area, and that's called the platysma muscle. And that can blunt the sharp angles that we tend to like in the jaw area. And then it can be used in muscles of the neck, which also pull down on our neckline and can create these horizontal lines in the neck. We might call them you know, tech lines or tech neck or something like that from looking down on our iPads, our iPhones, so it can be used in that area. Today, we are just going to really focus between the eyebrows for her and giving her a little bit of a brow raise and fixing some asymmetries. So the first thing we do is, you know, I'm going to put on some gloves here and prep the patient. So she already has clean skin, but we always keep the skin clean, and we use alcohol or Hibiclens to keep that skin clean. And then I'll mark her out. So here's a little alcohol. All right. And I'm going to mark her out. So I'm going to have her make some expression. Go ahead and make your angry face for me. Good. And I kind of help them along. Some patients without a mirror in front of them, they tend to not be able to make the expressions that you ask for. And so you can just kind of help them along here and relax. And then if you look at her brow height, she is higher on this side than on this side. So what I'm gonna do, what I'm gonna do there, I'm gonna stick this here, okay, is actually inject in the lateral brow here to release the orbicularis oculi muscle that actually pulls down on this brow and help it raise a little bit more so it matches the height of this brow. And that's it. I mean, she's beautiful. I mean, smile real big. She barely has any crow's feet. Raise your brows. She barely has any lines in her forehead. And she has a nice upturned corner of her lip. So we don't need to inject down in here. And she has no lines around her upper lip to inject around the upper lip area. So what I'm going to do next is we have pre-drawn her syringes for her. So when I start with injections, I always start between the brows. So I have patients close the eyes because I'm going to have a needle near their eye. I use the tiniest of needles. Patients oftentimes say, oh, am I done? I didn't feel you pinch me at all with that needle. So go ahead and make your angry face. Good, and I help it along. Okay. All right, angry face again for me. Good, and relax. Pinch. You okay? Okay. Good. And angry face again and relax. Good. And you can see there's really minimal bleeding with this type of procedure. Any type of bleeding usually stops within a minute or so. There is a risk of bruising, but that's really unusual to have any large bruising. Okay, angry face again. Good, and relax. Good, and angry face again. Good, and relax. So I'm just going to ask Alicia, how, on a scale of 1 to 10, how uncomfortable is this?
1 being nothing, it's definitely a 1.
Okay, good. All right. So now by relaxing these muscles in this area, what we're doing is we are relaxing the orbicularis oculi and the corrugator muscles up here. And what those muscles do is basically pull down on the eye. So I injected the corrugators already, and when you inject them to relax them, they can oftentimes relax and you get a more raised appearance to the brow. This is the part where I'll inject the orbicularis oculi and relax that muscle in the lateral brow area to help even out her two-brow asymmetry there. Okay, and so I have her close her eyes really tightly, as hard as you can. Good. And then I inject it. Oops, relax. There you go. And up here. Good. Now you might see a little bit of redness at the injection sites and a little raised bump that goes away just in a few minutes. And most people walk out of here, go back to work or whatever they were doing earlier that day, and you really can't tell anything was done. So now I'm not going to inject this lateral brow because I want this brow to relax and start to match this other brow. So I'm only going to inject that one side today. Usually I see patients back in about 10 to 14 days, and I do a touch-up, which a lot of patients don't need, but I like to make sure, especially after they've been injected for the first time, that we achieve the goals that they were looking for and that they don't need a little tweakment, a little unit here or there to make sure they're symmetric and happy. And then, the only downtime or restrictions that we tell patients is no exercise for 2 hours after, sit upright, no clarisonics the day of. We don't want product to be moved around. And really just gentle skincare. They can apply makeup, but just dab lightly. Side effects, rarely do they get a headache after the procedure was done. That might last for 24 or so hours. Again, we had talked about bruising, but if it happens, it's rare and minimal. And really, that's it. So how do you feel?
Great.
Good? And you've had this done before, correct? Okay. All right. So any questions?
I don't have. I get this all the time.
Oh, okay.
So, you look fabulous. I love it. I do want to point out that you could also follow Dr. Kittridge on Instagram. I was just on here. I follow you on Instagram. She's always putting a ton of like little tips and stuff like that out there. So Dr. Kittridge Derm, Kittridg Derm. So that's on there. You can visit our website, kittridgedermatology.com. And again, we'll have all of the links and everything like that in the post. So I'd say in conclusion, wear your sunscreen.
Absolutely.
Update your fall skincare regime to adjust to the lack of moisture in the air, because it's going to be lack of moisture in your skin.
Yes.
And if you have any questions, always reach out to your dermatologist. You can see Dr. Kittridge in Upper St. Clair, right by the Village. Thank you for being a good sport and letting us inject you on live television. That was really awesome. Thank you very much, Alicia. Thank you, Dr. Kittridge, for coming down today. This was awesome.
Thanks for
I hope,
having us.
and I learned so much. I had no idea about the plasma stuff. I'm going to be Googling the hell out of that after this. So thank you guys for watching. This will be up later today. So if you missed any parts of it, or you want to go back and watch it again, or you want to share it with your friends, you'll be able to. Again, Current Conversations with Pittsburgh Current. Thank you guys so much, and get out there and enjoy the rest of this day with your sunscreen on.
Yes.
Yes.
See you guys.
Thanks.